Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing articles in New England Journal of Medicine. Intensive blood pressure control in patients with type 2 diabetes. Background. Effective targets for systolic blood pressure control in patients with type 2 diabetes are unclear. Conclusions. Among patients with type 2 diabetes, the incidence of major cardiovascular events was significantly lower with intensive treatment targeting a systolic blood pressure of less than 120 mm Hg than with standard treatment targeting a systolic blood pressure of less than 140 mm Hg. Moving on to the next article. Inebilizumab for treatment of IG4-related disease. Background. IG4-related disease is a multi-organ, relapsing, fibro-inflammatory, immune-mediated disorder with no approved therapy. Inebilizumab targets and depletes CD19 plus B cells, and may be effective for treating patients with EAG4-related disease. Conclusions. Inebilizumab reduced the risk of flares of IG4-related disease, and increased the likelihood of flare-free complete remission at 1 year, confirming the role of CD19-targeted B-cell depletion as a potential treatment for IG4-related disease. Moving on to the next article. Tezepelumab in adults with severe chronic rhinosinusitis with nasal polyps. Background. Treatment with tezepelumab has been effective for sinonasal symptoms in patients with severe, uncontrolled asthma and a history of chronic rhinosinusitis with nasal polyps, but its efficacy and safety in adults with severe, uncontrolled chronic rhinosinusitis with nasal polyps is unknown. Conclusions. Tezepelumab therapy led to significantly greater reductions in the size of nasal polyps, the severity of nasal congestion and sinonasal symptoms, and the use of nasal polyp surgery and systemic glucocorticoids than placebo in adults with severe, uncontrolled chronic rhinosinusitis with nasal polyps. Next, we will be discussing articles from Journal of American Medical Association. Long-term risk of stroke after transient ischemic attack or minor stroke. A systematic review and meta-analysis. Question. What is the long-term risk of stroke after transient ischemic attack, TIA, or minor stroke? Findings. In this systematic review and meta-analysis of 171,068 patients with TIA or minor stroke from 38 studies, the risk of subsequent stroke was 5.9% within 1 year, 12.8% within 5 years, and 19.8% within 10 years, meaning patients who have had a TIA or minor stroke are at a persistently high risk of subsequent stroke. There is a need for continued improvement in long-term stroke prevention. Next, we will be discussing articles from Annals of Internal Medicine. Excess mortality rate in Black children. Since 1950 in the United States, a 70-year population-based study of racial inequalities. Background. Black Americans have lower wealth, income, and education and higher mortality rates than white Americans, especially during childhood. Conclusion. Black infants, children, and adults have experienced persistent excess mortality in the United States since the 1950s relative to the white population. Next, we will be discussing articles from British Medical Journal. Effects of intensive blood pressure treatment on orthostatic hypertension, individual level meta-analysis. Objective to determine the effects of intensive blood pressure treatment on orthostatic hypertension. Conclusions. In this pooled cohort of adults with elevated blood pressure or hypertension, orthostatic hypertension was common and more intensive blood pressure treatment modestly reduced the occurrence of orthostatic hypertension. These findings suggest that approaches generally used for seated hypertension may also prevent hypertension on standing. Next, we will be discussing articles from Lancet. Mapping the global prevalence, incidence, and mortality of Plasmodium falciparum and Plasmodium vivax malaria, 2022, a spatial and temporal modeling study. Background. Malaria remains a leading cause of illness and death globally, with countries in sub-Saharan Africa bearing a disproportionate burden. Global high-resolution maps of malaria prevalence, incidence, and mortality are crucial for tracking spatially heterogeneous progress against the disease and to inform strategic malaria control efforts. We present the latest such maps, the first since 2019, which cover the years 2022. The maps are accompanied by administrative-level summaries and include estimated COVID-19 pandemic-related impacts on malaria burden interpretation. The unprecedented investment in malaria control since the early 2000s has averted an enormous amount of malaria burden. However, case incidence rates in Africa have flattened, and with a rapidly growing population at risk, the number of P. falciparum cases in Africa, and thus globally, is now comparable to levels before the surge of investment. Outside Africa, progress against malaria morbidity continued after 2015, but a resurgence of P. vivax cases in 2022 underscores the fragility of progress against malaria in the face of climatic shocks. COVID-19-related disruptions led to increased malaria cases and deaths, but the impact was less severe than feared, in part because endemic countries continued to prioritize malaria control during the pandemic. Nevertheless, improved tools and strategies remain urgently needed to regain momentum against this disease. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Hepatology Predictors of Hepatic Flares After Nucleoside Analog Cessation, Results of a Global Cohort Study, RETRACT-B Study. Flares are common after NA cessation, 5-year, 33%, and can still occur after 1 year. These flares do not increase HBsAg loss and should be considered undesirable events. HBsAg greater than or equal to 100 IU/ml at end of therapy, TDF and male sex were associated with increased flare risk. Retreat if, early, HBV DNA levels exceed 5 log 10 IU/ml. Next article. Intention to treat outcomes of patients with hepatocellular carcinoma receiving immunotherapy before liver transplant, the multicenter Vitality study. Immune checkpoint inhibitors exhibit significant potential in neoadjuvant therapy for advanced hepatocellular carcinoma. First multicenter U.S. study demonstrating feasibility of pre-transplant immunotherapy and favorable outcomes in intention to treat analyses. Successful integration of immune checkpoint inhibitors into pre-transplant management is supported by effective tumor size reduction, positive survival, safety, and rejection rates endorse continued application and scrutiny of preoperative immune checkpoint inhibitors. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Multi-cohort analysis reveals altered archaea in colorectal cancer fecal samples across populations. Background and aims. Archaea are important components of the host microbiome, but their roles in colorectal cancer (CRC) remain largely unclear. We aimed to elucidate the contribution of gut archaea to CRC across multiple populations to inclusions. This multi-cohort analysis uncovered significant alterations in gut archaea and their interactions with bacteria in healthy individuals, patients with adenoma, and patients with CRC. Archaeal biomarkers, combined with bacterial features, have potential as non-invasive diagnostic biomarkers for CRC. Here are the articles from Clinical Gastroenterology. Treatment of the buried bumper syndrome: a retrospective multicenter study with inclusion of 160 cases. Background and goals. The therapy of buried bumper syndrome, BBS, is difficult. The aim of this retrospective multicenter study was to analyze the treatment methods with focus on effectiveness and safety of endoscopic techniques. Conclusions. Endoscopic therapy of BBS is treatment of choice in most cases with removal of incomplete BB by PPT. In case of complete BB, PT appears more effective than NPT. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Peer-assisted telemedicine for hepatitis C in people who use drugs, a randomized controlled trial. Background. Hepatitis C virus, HCV, elimination requires treating people who use drugs, PWUD, yet less than 10% of POO in the United States access HCV treatment. Access is especially limited in rural communities. ONS conclusions. The peer-tele HCV treatment model substantially increased HCV treatment initiation and viral clearance compared to UC. Replication in other rural and low-resource settings could further World Health Organization HCV elimination goals by expanding and decentralizing treatment access for POO. Next, we will be discussing articles in the field of rheumatology. The design of a randomized controlled active comparator strategy trial for gout, treat to target serum urate versus treat to avoid symptoms. Objective. Controversy persists regarding the optimal management of gout in routine primary care. There is a lack of clarity on whether treating to a target serum urate, TTT-SU, versus treating to avoid symptoms, TAS, is more effective. This randomized controlled active comparator strategy trial will answer a key question in the treatment of patients with gout in primary care: the comparative effectiveness of TTT-SU versus TAS in gout. Secondary and exploratory outcomes will add important information regarding the broader extra-articular and quality of life effects of lowering SU levels. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Activation of imprinted gene PW1 promotes cardiac fibrosis after ischemic injury. Background. Cardiac fibrosis, characterized by excessive extracellular matrix, ECM, deposition in the myocardium, is an important target for heart disease treatments. PW1, paternally expressed gene 3, is an imprinted gene expressed from the paternal allele, and de novo purine biosynthesis, DNPB, is a crucial pathway for nucleotide synthesis. However, the roles of PW1 and DNPB in ECM production by cardiac fibroblasts during myocardial ischemia are not yet understood. This study demonstrates that PW1 imprinting is disrupted after injury, and reveals a novel role for the downstream target Phys in ECM production and cardiac fibrogenesis. Targeting the PW1/Phes signaling pathway presents a promising therapeutic strategy for improving cardiac repair after injury. Here are the articles from Journals of the American College of Cardiology. Transcatheter versus surgical aortic valve replacement in lower-risk patients. An updated meta-analysis of randomized controlled trials. Background. Longer-term outcomes are especially important for lower-risk patients with severe aortic stenosis undergoing transcatheter aortic valve replacement, TAVR, or surgical aortic valve replacement, SAVR. Additional randomized data comparing TAVR and SAVR have recently become available. Objectives. The purpose of this study was to perform an updated systematic review with conventional pairwise meta-analyses and pooled survival analyses using reconstructed time-to-event individual participant data, IPD, including the totality of randomized evidence comparing longer-term clinical outcomes after TAVR and SAVR in lower-risk patients. In lower-risk patients, TAVR was associated with a reduced hazard of death and death or disabling stroke compared with SAVR, while rates of stroke were equivalent. Most patients have not yet undergone 5-year follow-up, and so these findings may change as further longer-term data become available. The present data are informative for lower-risk patients and treating clinicians, but further randomized trials and longer-term follow-up are required, particularly in younger patients. From JAMA Cardiology. Intravascular sympathetic stimulation to facilitate catheter ablation of premature ventricular complexes. Questions. Can stimulation of the sympathetic nervous system from the vertebral veins, VVs, be used to facilitate catheter ablation of premature ventricular complexes, PVCs? Findings. In this case, series of 15 patients with rare intraprocedural PVCs at the time of catheter ablation, stimulation from VVs was safely used to induce PVCs, facilitating activation mapping in 7 patients, and ultimately, successful ablation in 9 patients. Meaning these findings suggest that intravascular stimulation of the sympathetic nervous system via the VVs can be used to safely induce PVCs at the time of catheter ablation. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Iron status correlates strongly to insulin resistance among U.S. adults, a nationwide population-based study. Context: evidence on the link between iron status markers and insulin resistance, IR, is limited. Objective: we aimed to explore the relationship between iron status and IR among U.S. adults. Conclusion: all biomarkers demonstrated significantly lower risk of IR with increasing iron levels, which will contribute to a more comprehensive and in-depth understanding of the relationship between the two, and provide a solid foundation for future exploration of the mechanisms underlying their relationship. Here are the articles from Diabetes Care. 3-year follow-up. After antiviral treatment in new-onset type 1 diabetes. Results from the Diabetes Virus Detection and Intervention Trial. Objective: in the Diabetes Virus Detection and Intervention Trial, antiviral treatment with plecanaril and ribavirin decreased the decline, compared with placebo, in endogenous C-peptide 1 year after diagnosis of type 1 diabetes, T1D, in children and adolescents. This article reports the results 2 and 3 years after diagnosis. Conclusions: the decreased reduction in C-peptide levels after antiviral treatment is no longer present after 2 or 3 years. Further investigations are needed to explore options to use antiviral treatment in the prevention and treatment of T1D. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Associations of plasma neurofilament light levels with brain microstructure and macrostructure and cognition in the community-based Rhineland study. Background and objectives. Plasma neurofilament light chain, NFL, level, is a sensitive yet aspecific marker of neurodegeneration. Its neuroanatomical and functional correlates in the general population are not fully elucidated. We thus assessed how brain's macrostructures and microstructures and cognitive function are related to plasma NFL levels in cognitively unimpaired adults over a wide age range. Discussion: higher plasma NFL levels mainly reflect worse white matter microstructural integrity, especially lower axonal density, in a relatively healthy, community-based sample. This suggests that plasma NFL levels allow for early detection of subtle differences in brain microstructure. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Implementation and effectiveness of guideline-recommended clinical activities for children with asthma. Background: guidelines advise minimizing asthma exacerbation risk, which is achieved partially through good clinical practice activities, including scheduled asthma reviews, inhaler technique checks, and asthma management plans. We assessed how frequently these activities are provided and how effective they are in clinical practice. Research question: do guideline-recommended activities such as asthma reviews, inhaler technique checks, and asthma management plans prevent asthma exacerbations? Interpretation: our results indicate that most children in the United Kingdom do not receive the guideline-recommended activities to monitor their asthma. This study suggests that these activities, if implemented, are effective in clinical practice and maximally effective when combined in the same visit. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Randomized clinical trial of the 4 supports intervention for surrogate decision-makers in intensive care units. Rationale: individuals acting as surrogate decision-makers for critically ill patients frequently struggle in this role and experience high levels of long-term psychological distress. Prior interventions that were designed solely to improve information sharing between clinicians and family members have been ineffective. Objectives: We sought to examine the impact of a multi-component family support intervention on patient and family outcomes. Conclusions. Among critically ill patients at high risk of death or functional impairment, a family support intervention delivered by an external interventionist did not reduce surrogates' long-term psychological symptom burden. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. A pilot trial of nicotinamide riboside and coenzyme Q10 on inflammation and oxidative stress in CKD. Nicotinamide riboside and coenzyme Q10 supplementation showed distinct beneficial effects on whole blood transcriptome, inflammatory cytokines, and oxidative stress. Nicotinamide riboside treatment altered the expression of genes associated with metabolism and immune response, coinciding with a decrease in markers of oxidative stress. Coenzyme Q10 supplementation altered genes associated with lipid metabolism, coinciding with reductions in markers of oxidative stress and inflammatory cytokines. Here are the articles from Kidney International reports efficacy and safety of rituximab in antiglomerular basement membrane disease. Introduction. Antiglomerular basement membrane (GBM) disease is caused by pathogenic antibodies usually targeting the non-collagenous domain of the alpha-3 chain of type 4 collagen and frequently presents as rapidly progressive glomerulonephritis and diffuse alveolar hemorrhage (DAH). Rapid reduction of these antibodies is imperative for kidney survival, and the mainstay of therapy is the combination of plasma exchange, PLEX, glucocorticoids, and cyclophosphamide. Rituximab has been postulated as a potential treatment for anti-GBM disease. However, data on efficacy and safety are lacking. Conclusion. Acknowledging the limitations of our study, including publication and selection bias, rituximab had a favorable toxicity and efficacy profile. The results indicate that rituximab can be considered as a second-line therapy in anti-GBM disease when cyclophosphamide is contraindicated. Next article from Key. Obinutuzumab and ofatumumab are more effective than rituximab in the treatment of membranous nephropathy patients with anti-rituximab antibodies. Introduction. Although rituximab has significantly improved outcomes for patients with membranous nephropathy, response to treatment is not universal, and drug resistance can occur. One mechanism of resistance is the occurrence of anti-drug antibodies. Obinutuzumab and ofatumumab are humanized and human monoclonal antibodies, respectively, that target B cells. These treatments have been shown to be effective in membranous nephropathy. However, obinutuzumab and ofatumumab have never been compared with rituximab in the treatment of patients with membranous nephropathy with anti-rituximab antibodies. We aimed to compare the efficacy and safety of obinutuzumab and ofatumumab with rituximab in patients with membranous nephropathy with anti-rituximab antibodies. Conclusion. Obinutuzumab and ofatumumab are more effective than rituximab in treating patients with membranous nephropathy with anti-rituximab antibodies. Anti-rituximab antibodies should be systematically monitored to determine appropriate treatment.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.